basically for this exercise, you don't need any equipment necessarily. If you were on like a tougher floor that's hard to slide on, you could put like a paper plate or a small rag or towel underneath your foot or your toes to help it slide easier, but you should just be able to kind of slide that leg back without any problem. So what we're doing here is you're going to come onto hands and knees. I want to make sure that your back is in a more of a neutral position. So basically we don't want you excessively arched, and I don't want you rounded all the way up here. So find somewhere in the middle that feels good for you. Again, another thing is we don't want your elbows like hyperextended. So if you're real flexible, hypermobile, you might have a tendency to hyperextend your elbows. So try to keep a slight bend. That will also help you kind of push the floor away. You should feel kind of these scapular muscles turn on right around your shoulder blades. That's going to help you set up in a good position. It's also going to help keep your rib cage and your pelvis in a good position, help our abs fire better. So in this position, you are going to take an inhale through your nose. Think of expanding through your rib cage 360 degrees. So your back, your sides, your belly should all fill with air. Pelvic floor should relax. So inhale through your nose. Exhale, hug belly up and inwards. So hug especially your lower belly, the area below your belly button. Draw that area inwards towards your spine as you exhale through your mouth with an open mouth. So you can either go, or you can act like you're blowing out birthday candles, more of like a, as you slide one leg back behind you. Toes are staying in contact with the floor the whole time for this exercise. So you should feel this glute fire up as you come back. You should feel your lower abs kick on. This is where you might spill into this anterior pelvic tilt, so make sure you keep that neutral spine here. Abs engaged. If you are pregnant, you want to think of hugging baby up and in towards your spine, okay? And then you're going to inhale, release, come back to the start position. Exhale. Extend the opposite leg behind you. What I don't want, we already talked about spilling into that anterior tilt, but what I don't want is a bunch of side-to-side tipping. So if you're bringing this leg back and you're shifting all the way over here, opening up through this opposite hip, that's not what we want. We want to keep your hips square, pointing down towards the floor. You should feel your glute fire. Abs should be engaged the whole time. You should not feel pain in your back. So if you're feeling pain in your back, you may not be ready for this exercise. And in that case, you can just stay here on hands and knees, and you can work on exhaling and engaging that lower belly, drawing the lower abdomen upwards towards your spine. Or instead of sliding your hip back, you could always try lifting an arm instead. That's going to be a little bit easier than sliding your leg backwards. So give that a try. We want to do both sides here. And again, make sure your deep core system is engaging and coordinating well with your breath. So inhale, everything relaxes and expands. Exhale is when we do the contracting and engaging our lower abs. And you can even get the pelvic floor on board here too during the exhale by trying to exhale from the bottom up, meaning gently squeeze and lift the pelvic floor first as you are then kind of drawing your lower belly in next. So you can coordinate everything together for this exercise and make sure you alternate sides.